Hello, my name is Susie Linden. I want to thank you for letting me speak to you today about a study entitled The Effects of Motivational Interviewing Intervention on Blackouts Among College Freshmen. A team of researchers led by an RN named Donna Kazemi identified a serious public health issue among college students, and that has to do with drinking and drug use. It's pretty widely known that drinking and drug use is tied to some of the most desired aspects of American college life. Kazemi and her team would say that this is the picture globally on campuses. The literature supports that, and the literature also highlights the negative consequences associated with drinking, and you'll see here that some of them are pretty scary. The memory loss that you see here is referring to interrograde amnesia, blackouts, and that is when you can talk to your friends, you can drive your car, you can interact socially with your friends and your environment, but you can't recall any of the events. Literature that they reviewed outlined some of the neurotoxic effects to specifically the developing young adult brain. Literature also strongly linked blackouts to drug and alcohol use. Here's a nurse some of you may recognize. As student nurses, we know that education is going to be a huge part of our future roles as RNs, and how well we do that and teach our patients can depend largely on how motivated the patient is to actually change behavior. So this team of researchers were mostly RNs, and they saw the significance of this. So much the same as nursing interventions are patient-tailored, motivational interviewing interventions are very person-centered. And they've been proven, motivational interviewing has been proven to change behavior and reduce drinking. Now, this study was the first, though, to look at MI's effect on blackouts. So the study questions here are, would motivational interviewing reduce blackouts over 6 months? And what is the association between blackouts and the reduction of drinking and drug use across race and gender? So we want to know, was this study designed in a way that could answer those research questions? So we take a look at the study framework, and it was the MI harm reduction alcohol skills training approach. So MI is basically one-on-one 50-minute interventions with a trained interventionist who gives education and personalized feedback at baseline, 2 weeks, 3 months, and 6 months. The education was kind of neat, and in that, for example, they gave the students blood alcohol level cards that were color-coded according to the alcohol they drank and their gender and what the severity of the physical effects would be of drinking that much alcohol. The students were also given personal feedback forms at the 2-week intervention, and they were able to discuss this with question and answer sessions. The way they gathered the data was by giving 3 questionnaires, the DDQ, the RAPI, and the GRPA. Drinks and drugs, well, drinks, first of all, were measured in terms of the weekly number, frequency, and peak number of drinks per week. The drinks and drugs would be considered dependent variables when we are looking at their relationship to blackouts. When we look at their relationship to race and gender, or possible link to race and gender, they become the dependent variables. And race and gender are the independent, uncontrolled independent variables. Blackouts are dependent variables. The drinks and drugs are, again, independent variables when you're looking at their relationship to blackouts. So here's 2 questions that were asked on the RAPI, and these were isolated to assess presence or absence of blackouts. So the study tells us what one drink consists of. It tells us that drug use is measured in the last 30 days. The sample was 188 students who were full-time freshmen, 95% of them living in freshman dormitories. They gave informed consent to participate in the study. IRB approval was sought and granted by the researchers. To participate in the study, you had to be 18 to 20 years old, full-time enrolled. You had to have drank alcohol in the past 30 days. You had to read and speak English, and you had to be willing to participate. 57% of this sample was white or European American, as the researchers indicate. 17% of them were African American, and as we see, the smaller slices of the pie include the Latino, Asian, and multiracial Americans. Blackout prevalence was reduced. 76 students at baseline reported having one, and 36 students at 6 months reported having had them. And of those 76 students who had a blackout at baseline, 55 of them reported no blackout at 6 months. Drinks per week, drug use during the week over the last month was reduced. And the blue bars represent measurements taken at baseline, and the red bars indicate measurements taken at 6 months. The only thing that did not change was the maximal number of drinks in a drinking session during the week. That stayed the same at an average of 3.5 drinks. So yes, MI resulted in less drinking and less blackouts, but there was no link to race or gender in the reduction rate. Drinking less meant you had less blackouts, whether you were male, female, or whatever race you were. When we look at the association between the prevalence of blackouts and the reduction of drinking and drug use across race and gender, we see that when women drank more, they were more likely to black out, whereas when the men drank more, they did not black out more. And this was primarily due to the fact that women eat less and weigh less, eat less when they drink and they weigh less, and that is supported by literature. One of the conclusions was that MI is more effective at decreasing females drinking associated with blackouts. Blackouts was linked to gender and number of drinks, and blackouts did increase for a few, only for drug users at 6 months. Here are the study limitations, and as we see, truthfulness shows up a lot in studies where the assessments are taken in the form of questionnaires. Were they truthful? Was there social desirability bias? Because there was no control group and no randomization. So these students could have been answering in a way that put them in a more socially desirable light. The researchers see a significant need for nurses to be trained in MI intervention, and we can see in our own local community a significant need for this, especially when we consider recent news. Many of you may have heard that there were as many as 60 admissions to local emergency rooms for drug overdose. And this was related to a synthetic marijuana. Many of these patients had to be put on ventilators, and teens in this population were as young as 13 years old. Nurses need to be creating strategies that prevent drug and alcohol use among our young people, and school nurses and university health clinic nurses could be prime targets for this motivational interviewing training. So in conclusion, I'd like to say that despite the limitations of the study, it was a very sound study. It had a large sample size with no attrition rate. MI resulted in positive outcomes. The students themselves even had positive responses and reflections on the intervention itself. Future motivational interviewing would need to be gender specific, tailored to whether you're a male or a female. And future studies that are suggested might want to look at the long-term effects of motivational interviewing. I want to thank you for letting me speak to you today about this study. And if there are any questions, feel free to email me.